The topic of my talk is natural homeopathic and Chinese herbal treatment of in utero Down syndrome diagnosis. In treating successfully 3 diagnosed women during various stages of confinement with Down syndrome fetus, the author proposes a theoretical understanding into the nature of birth anomalies, a method of predictive diagnosis for these anomalies, and their homeopathic and Chinese herbal treatments, leading to a complete reversal of the anomaly and a normal birth. During my medical career, I've had the pleasure of treating many interesting health challenges, but 3 stand out because of the unique insights they provided into the diagnosis and treatment of in utero Down syndrome. As a doctor of traditional Chinese medicine, we learn of innumerable types of qi energy, and to the ancient Chinese practitioners with no access to modern diagnostic examinations, they envisioned and described ancestral qi, which they also termed as yuan qi or original qi, as the causative factors governing the development of the body we inhabit. Lacking insights provided by modern blood tests, ultrasound, and amniocentesis, there was little these ancients could propose, let alone do, to intervene, and the ancestral qi was therefore a fait accompli, for which medicine had no answers. In the first 2 cases, both women were in their mid to late 30s, Hispanic, and unfortunately they shared an emotionally distraught pregnancy. The first was in an abusive marriage that she was leaving, and the second was under pressure from her husband after her diagnosis because he wished to get an abortion. One woman was diagnosed via a blood test, while the second by amniocentesis. In both cases, the reasoning that guided treatment was to increase nourishment to the fetus to see if normal development could right the abnormal diagnosis. The homeopathic remedies selected for the use and their corresponding rationale were Calcarea carbonicum. This remedy is derived from the calcium found on the inside of an oyster shell. The unmistakable image of calcarb is of hardness on the outside, but soft or incomplete on the inside. Boricke describes the remedy's keynote as impaired nutrition. As the growing fetus and later newborn infant, calcium is indispensable to foster proper and normal development and maturation. Boraticarb, this remedy is especially for children who do not thrive, backward, delayed in development, mentally as well as physically. It's almost specific for Down syndrome and delayed development. But all too often its real usefulness is missed as it is employed after birth rather than during fetal development. Calcarea phosphorica, the keynotes for this remedy are malnutrition and malabsorption, leading to slow and stunted development. And bioplasma, a remedy that combines Dr. Schulster's 12 cell salts. These cell salts combine to form the building blocks of our bodily tissues and structures. The potencies administered ranged from 12 to 30 C, and the cell salts combined to form building blocks. These remedies were alternated over the course of the confinement with the onset of diagnosis, and our care in both cases were to begin in the first trimester and extend all the way through delivery. In addition, the following Chinese herbal formulas were administered in easy-to-use pill combinations and forms. Unlike herbal teas, whose strong odors can sometimes inadvertently contribute to morning sickness, herbal pills have the benefit of being well tolerated and easy to use, which leads to increased patient compliance. Patients were given a mixture of 3 formulas and instructed to take 20 pills with warm water 3 times daily. The herbal formulas used were Shenling Baizu Wan, ginseng, poria, and white atractolotus formula. The formula is designed to treat various deficiencies by tonifying, nourishing, and enriching the body. The formula acts to strengthen a weakened spleen qi. Thus, it improves digestion, removing dampness, and even helps to reduce nausea and vomiting, thus proving indispensable for treating morning sickness. The formula is useful too in treating malnutrition of children and is safe to take during pregnancy and for extended periods of time. Now, the ingredients of these formulas I'm going to be discussing, I've given to Ms. Joseph, and for conference members, you can certainly ask her. I was unable to get it up on the screen concurrent with my talk. The second formula employed was Ba Zhen Wan, 8 precious ingredients decoction. This formula treats both the deficiency of qi and also that of blood. It strengthens spleen qi, thereby stimulating the appetite. And by enhancing the nourishment of the mother, we provide increased nourishment to the growing fetus. The third and last herbal formula used can best be understood when we understand traditional Chinese medicine's understanding of what governs our body's development. To the Chinese, the kidney qi oversees the fetal development, and while a number of herbal formulas treating our kidneys may be employed, one that is well tolerated and often utilized for retarded growth and maturation in children is Lu Wei Di Wang Wan. The first woman delivered a healthy baby girl, while the second delivered a healthy baby boy. Neither child showed any of the telltale signs of Down syndrome. These two cases best illustrate what I would describe as a nutritive corrective approach in treating birth anomalies. While I believe this approach is essential at correcting the course of fetal development, it really does not lend itself to better understanding how these illnesses arose, nor does it help us to theorize about them in a way that could guide us to effective treatments during critical stages of fetal development. The third case allowed for exactly these insights into causation, as well as a more robust and comprehensive program of care that expands upon and complements the nutritive corrective approach. In both of the previous cases discussed, the women attended to were pre-existing patients. Long under care with natural medicine, they both enjoyed a foundation of well-being. Furthermore, they were diagnosed early in their pregnancies and treatment began in the first trimester. None of these benefits would apply in the third case. The third young woman was decidedly younger than the first at age 29, and she was Black and not Hispanic. A first-time pregnancy, she received the news of a Down's diagnosis late in her first trimester. Unsure how her boyfriend would react to the diagnosis, one of her friends, a former patient of mine, suggested she come and see me. And she did in the very early stages of her second trimester. What made this case so unique was her physician had performed certain lab tests that were looking for infections and immunity levels. And on 2 such exams, the hepatitis B, the QuantiSure level was greater than 360, and the second exam, rubella, the QuantiSure level was greater than 132.4. In both instances, her physician had dismissed these findings as evidence of immunity. However, new scientific evidence suggests that elevated levels of antibodies may also indicate either reinfection as well as severe chronic infection. I've always treated elevated QuantiSure levels as evidence of an ongoing, active bodily reaction to an illness. However, in the absence of symptoms, we may think of it as an autoimmune reaction in our body. In this particular case, our treatment necessarily had to begin at reducing these white blood cells counts, which would mean treating old, neglected, chronic illnesses and the inflammation they established. Homeopathic medicine, I believe, is unique in the variety of medicinal potencies which allow for access to different energetic levels in our body. The best homeopathic remedy to treat hepatitis is homeopathic phosphorus. Through muscle testing, it was determined she needed to begin at 100 C potency. This was followed by a course at a 200 C potency. Each was taken twice daily for 5 days with 5 days break between the two remedies. After this, homeopathic rubella 1M potency, a nosode made from the rubella virus, was administered. In her follow-up hepatitis exam, the QuantaSure levels had now returned to normal. It took some cajoling to coax her physician to repeat the previously rubella exam, but he finally relented, and in December of 2020, the results too were normal levels. In early January 2021, the patient shared with me an observation of her OBGYN physician after a routine ultrasound exam. The physician, unaware of our treatments, told her something was changing in her fetus. Now, with the constraints of illness and inflammation removed, we turned our attention to the nutritive corrective approach outlined previously. We introduced the Chinese herbal treatments to help nourish the mother and fetus, while also utilizing homeopathic Calcarea carbonicum and Calcarea phosphoricum and the biochemic cell salts. Late in her 8th month of pregnancy, she was diagnosed with Group B streptococcus infection, or GBS. Her physician refused treatment, stating he would treat her postpartum, despite evidence that GBS bacteria can be passed on to the fetus during birth. So we administered homeopathic Streptococcus B 200C and again 60C potency. She was still under treatment when she went into labor. In late March 2021, she gave birth to a healthy, completely normal baby girl without any of the signs of Down syndrome. The mechanism of birth anomalies. So what happened, and can what happened here in this case provide a protocol to use in other pregnancies where a birth anomaly is suggested? A number of years ago, scientists investigating the human genome found something heretofore unknown. Surrounding our gene is another layer that they termed the epigene. We now know that this epigenetic layer can be affected and thereby downregulating the gene. I believe these case studies clearly suggest one of the mechanisms that creates downregulation of gene expression is chronic infectious disease and our body's overreaction to past illnesses. This then is our theoretical understanding for birth anomalies. Our body's overreaction to past disease sets up an autoimmune reaction whereby excessive white blood cells attack developing fetal cells. Furthermore, this interference somehow affects the epigenetic layer to downregulate or turn off the gene expression, giving rise to a panoply of birth anomalies, of which Down syndrome is but one. I believe in time and with more research, we'll find the wide variety of birth anomalies are due to a combination of infectious agents at work and the month of fetal development when either the disease was contracted or the autoimmune reaction took place. Current hospital policies recommendations for parental screening extend to the following illnesses: HIV, syphilis, hepatitis B, and hepatitis C virus. Additional screening for at-risk women often includes chlamydia, gonorrhea, and tuberculosis. Not only is this list inadequate, but as we've seen in the case of our third patient, even with elevated titer counts, the normal medical explanation provided the patient is that you have a robust immunity to those infections, which therefore becomes the pretext to do nothing. As such, I propose all women wishing to either become pregnant or who are pregnant be screened for a wider variety of infectious diseases. We can start with a list of diseases suggested by the United Nations World Health Organization. This list includes the following: syphilis, hepatitis A, B, C, AIDS, cytomegalovirus, Toxoplasma gondii, Epstein-Barr virus, human T lymphotropic virus, herpes simplex 1 and 2, and to this list I would add rubella, herpes 6AB and 7. Positive results, that is, elevated Quantisher numbers, should be interpreted as possible chronic illnesses or, given the fact the patient is asymptomatic, an autoimmune reaction from past infections whereby the white blood cells are now attacking the developing fetal tissue. Treatment with high-potency homeopathic nosodes are both safe and efficacious, and treatments can and must be monitored with follow-up exams until the elevated Quantisher numbers abate and return to lower, more normal numbers. After all infectious illnesses are removed, then the nutritive corrective treatment protocol can be initiated for the remainder of the pregnancy. Now comes something perhaps a little more controversial. Until such understanding of these illnesses is better fleshed out, the practice of vaccinating pregnant women, I believe, must be put on hold. Rather than protecting the unborn, we may very well be putting them at unwanted risk. In summary, birth anomalies are not an edict from heaven. They do not arise from our mysterious ancestral chi. Pregnancies that are now terminated in poorer countries based solely upon ultra-diagnosis of possible birth anomalies now have a blueprint both to understand that anomaly as well as to move that pregnancy towards a corrective and normal development. The use of homeopathic remedies and traditional Chinese herbal treatments offers a new, effective, safe, and inexpensive treatment administered to the mother during confinement. Such a treatment can help guide our ancestral qi to its proper and full expression of our human health potential. Well, I want to thank you again for allowing me to participate. I certainly hope that you have heard the talk